Good morning, everyone, and thank you all for joining today. I'm Lindsay Goldfarb, Director of Healthcare Education at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insights webinar. MHA is excited to continue this series, which features candid interviews of hospital leaders and will continue throughout 2021. Today's theme is From Patients to Populations. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have any questions during the webinar, please type them into the chat box. The questions will come directly to us, and we'll do our best to address as many as we can during the webinar. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I'd also like to take a moment to thank MHA's 2021 sponsors for their support in underwriting MHA's educational programs. In particular, I'd like to thank today's program sponsor, e-Ink. A valued supporter of MHA, e-Ink is a pioneer in e-paper technology and digital displays. Now I'll hand it over to Tim O'Malley, AVP for the US Regional Business Unit from e-Ink, to say a few words. Tim, over to you.
Great, thank you, Lindsay. e-Ink is honored to sponsor this session of the Executive Insight Series. e-Ink is a technology company, actually founded here in Massachusetts out of the Media Lab, that has pioneered the invention of digital paper. We are passionate about improving the availability of information with healthy and sustainable digital paper solutions. You may know us from our work on the Amazon Kindle, in signs around town, such as in Government Center and Kendall Square, or from Invented Here plaque located at Logan Terminal C. And now we are bringing our digital paper to hospitals and to healthcare with digital whiteboards and eNote solutions. Our digital whiteboard marries the visual appearance of a whiteboard, reflective, easy to read, no blue light, low power, with the accuracy and labor saving of connecting it to the EMR. It could be your whiteboard that is always up to date, translated to a target language without any need to remember to erase it or rewrite it. We have a pilot program and a real desire to work with Massachusetts hospitals to demonstrate the advantages. There'll be contact information shared after this webinar, and we'd be happy for people to reach out. And now it's my pleasure to turn it over to your moderator, Steve Walsh, President and CEO of MHHA. Thank you.
Thank you, Tim, and thank you for taking a few minutes to share some of the exciting things that you and your team are working on. And thank you, Lindsay. It's great to be starting off another morning with another episode of our Executive Insight series. We've gotten to know many of our local healthcare leaders in a new light since we kicked off this series earlier this year. And we're grateful that you continue to join us to be part of these important conversations. Today, it's our pleasure to continue the dialogue with Dr. Ann Klibanski, who leads our state's largest healthcare system, Mass General Brigham. Dr. Klibanski was appointed to her role as President and CEO in 2019, previously serving as the organization's Chief Academic Officer and as Chief of Neuroendocrine Unit at Massachusetts General Hospital. Dr. Klibanski is recognized internationally for her research in neuroendocrine disorders and pituitary tumors. She has overseen major initiatives during her time at MGB, including Partners 2.0 and task forces on strategic and operational issues. She's now charged with continuing to advance an integrated system for the future, all with patients at the center. Dr. Klibanski is also renowned for her mentorship and influence on our healthcare community at large. Dr. Klibanski received a BA in literature from Barnard College and an MD from New York University Medical Center. Dr. Klibanski, thank you for joining us this morning and welcome.
Thank you very much, Steve. Pleasure to be here and a pleasure to join all of you this morning.
To kick things off, several of the CEOs we've spoken with have medical backgrounds, but each kind of has a different story on what led them to the field. What drew you into medicine and how did ultimately you end up as a president and CEO of MGB?
Well, thanks, Steve, for that question. It's an interesting one. Everyone has an individual journey and a story. I would say that certainly early on, I was influenced by my father, who was a neurologist and a psychiatrist. I was always drawn to helping people and solving complex problems. When I was in college, As you noted, I was a literature major. I actually majored in modern British poetry, and people often say, "Well, where did you go from poetry to this?" And I think it was an interesting it's an interesting question. I was also a minor in chemistry, so I was always interested in, again, how things fit together in very complex structures. And that was coupled with a fundamental desire to help people. So as time went on, I became more and more interested in the relationship between brain, behavior, and that really led me into medicine. And, once I came into medicine, I was very drawn to endocrinology, particularly neuroendocrinology. And I'll just summarize it by saying it is really dealing with complex systems that often become dysfunctional over time. And what you want to do is sort of step back and look at how you put things together in very complex ways so that you can really help patients and make the situation better. And that has been something that has always remained a constant in my thinking about medicine and so many things that are involved in this particular pathway.
So I actually majored in theater. So maybe in our next iteration of our fireside chat, we'll meet at the Wang Center and talk about the different career paths that we could have taken. But you're here and you are talking, we talked a little bit earlier about the evolution of healthcare and how quickly it is changing.
Yes.
What are one or two of the biggest things you've seen in terms of the way you deliver care over your decades in the healthcare space?
So I think that there are so many things. I'll pick two, as you've said. I think the first thing is really the understanding of the continuum of care and patient empowerment in that care. And when we talk about having the patient at the center of everything we do as a healthcare system, very dedicated to mission, to providing the highest level of care, to doing the best research, to teaching, to taking care of our communities. What we need to understand that all those things ultimately revolve around patients. And when we think about the delivery of care, that's also an incredible area of innovation and of new thinking. So the models of all care being delivered at a hospital, and in our case, at an academic medical center, that has fundamentally changed. People want and they need lower cost care, accessible care. And that continuum of care is really the critical element. Care that starts in the home, that then goes out to a nearby ambulatory center if you need to, going to a community hospital for the care that can be delivered there, and then going to an academic medical center for tertiary and quaternary care, getting the highest level of care that is so informed by the research and the innovation going on there, and then back out into the home. So thinking about this from a patient perspective, that continuum of care and what that really means for patients is so fundamentally important to how we are viewing things. It is us going to the patient, not the patient coming to us. And that really leads me to the second, I think, major advance or major change that is enabled this, that is the promise for this, and that's technology. And technology and the rise of technology in being able to really implement that vision and providing the best care. We couldn't be in a better place as a state, as a country, as globally in terms of that technology. Everywhere you look, there's an explosion in technology. And maybe I'll just give you one example of that, because this gets to the technology that's there that can help deliver that best care in the home or closer to home. And then there's the adoption of that technology. So this is known to all of us, I'm sure, on this call. The availability of telehealth and the ability to provide visits to the home, that technology has been there for a long time. That's an example of known technology where the adoption was lagging. Providers were thinking, is this really the best way to deliver care? Don't I need to see a person in person to deliver that care? And yet, during the pandemic, we went from a few thousand visits across all of Mass General Brigham that were delivered this way to several million visits over time. And what changed? It wasn't new technology. It was the adoption of technology and understanding that during that pandemic, there was no choice. So that was a crisis, as we all know, but it also forced us to think about things in a fundamentally different way. So that access to care that can be provided through telehealth, that's profound. And I think the future challenge is, what are all those new technologies that are emerging that will make this so different, so that you really can get the kind of care in your home at lower cost that is so important for patients and for families? How do we help deliver that great care throughout the entire system, so patients do not have to come to an academic medical center? Wonderful care can be provided and is provided in the community hospitals, in the ambulatory settings, and in the home. And that is where technology adoption and an understanding of that can really, I think, make a very profound difference. And again, I have to just emphasize that continuum of care and reaching into communities and communities are very different. Serving an underserved community, again, that became so profoundly important during a pandemic. That just all needs to continue.
Sorry to just follow up for a minute on this, because this is the issue of the day, right? And I think as people watch us today, they desperately want COVID to be behind us, right? They want to go back to whatever their life was, the new normal, as we say now. And what a lot of people kind of watch the news on a daily basis don't know, is that capacity is a serious challenge right now.
Yes.
That, as of the last couple of weekends, we're searching for ICU beds in the Commonwealth. It's still really hard in our hospitals. Can the future be now? I mean, how do we accelerate some of the things you talk about to get that care back into the community? Is it just continuing on telemedicine, or are there other things that we can be doing?
Yeah. So you're absolutely right. The peak of the pandemic is behind us, but we still are in it. And I think just, for those people who have been listening to our infectious disease experts over many years, they kept telling us it's not an if, it's a when. We're a global world in the broadest sense right now. So there will be emerging things that will be happening. So what we're seeing now in our system across the state, it's not the COVID patients who are creating this huge and just overwhelming capacity challenge. It's all those patients who had delayed care. And the need for medical care in this state is profound, and it will increase over time. We have an aging population. We have more and more illnesses that we're seeing. So this is a challenge. So to your question, what do we do about it? I think one thing we need to do is to be very, very serious about how we think about redistributing care. We need to get out of this model of everyone comes to the hospitals. Will we need our academic medical centers across the state? Absolutely. And I've worked with those leaders, as you know, Steve, every day during the pandemic. There will always be a place where that highest level acuity care needs to happen. But we also need to be really, really understanding of the fact that there are thousands and thousands and thousands of people who are within the MGB system or within any of the other wonderful healthcare systems we have in the state, who need to get their care in community hospitals and in an ambulatory setting. So we just need to push patients out so that they can get that care. We need to do it quickly. We also need to be working very hard in terms of telehealth about the regulations around that. Because when we have patients who live in other states, as other healthcare systems do, it is very hard to deliver that care. So there are a lot of regulatory issues also. But I think the broader question is, these changes are here to stay. Still, the vast majority of our behavioral health visits are on telehealth. So the access is hugely important, but the crisis is still here.
We could spend another hour talking about behavioral health challenges, but I always hear you put patients first, and I always hear you talk about patients. I want to switch. You also have 80,000 people that rely on you, right? You oversee the largest healthcare enterprise in Massachusetts. I think our attendees are curious. How do you get up in the morning? What is that day like to manage that type of stress, that type of enterprise, and do it as well as you do?
Well, thank you for saying that, Steve. But I think a lot of it is really thinking about where we're going as a system. And I'd break it down into a couple of things. One is the fundamental excitement of knowing that the things that are going on every day across the system are really providing better care for people. And that is in and of itself really energizing. I look at what went on in terms of taking care of patients in underserved communities during the pandemic, how everyone came together to deliver the kind of care, the kits, the food, what was needed. That's how you look at a large organization like this one, and you put it together and you say, there's a common purpose. I look at the thousands and thousands of scientists across the system. They all came together during COVID. What are the best ways of approaching this? What are the new diagnostics? What are the potential cures? So there's that excitement, which I think is really important. And the second thing I would just emphasize, or, one of the things is just the day-to-day dedication of people who work in the system at all levels of the organization, whether people are providing direct care, whether they are maintaining our buildings, no matter where they are in the organization, delivering trays, all throughout the system. People are so dedicated to doing the kind of work that's inspiring. And then the third thing I'll mention is leadership. We have a fantastic leadership team across the system, and it is phenomenal. And having everybody who is in a leadership position come together toward this common challenge. How do we take the best care of patients? How do we do that through care, through research, through teaching, through serving the communities? That drive that brings us together, and that new leadership team is just fundamentally important. We have a new great president at Mass General, a new great head of the president of the PO at Mass General. We have a new great president of the Brigham coming in. We have a new great president at Cooley Dickinson. We have so many people at Spalding. The leadership team is phenomenal. And I think that ability to organize that in a new way and empower a leadership team to really work together, that makes things not only energizing, but doable every day.
So you've been talking about some of the new and exciting things that you think about as you think about your system and how to deliver better care. What will we be hearing about in the future for where you want to go as a system?
Yeah, I think one thing is really to focus on patient first, and I've mentioned that. We talk a lot about having a digital front door and access. What does that really mean for people? I want our patients, no matter where they are in the state, to be able to have the same experience and to be able to take advantage of the continuum of care. We're going to be hearing a lot. You're going to be hearing a lot more about that. How do we provide best care in the home? How do we use technology to really enable our patients, to get the best care so that they don't have to come in for care in a hospital or in an AMC unless that's the care they really need? I think the second thing is really taking advantage of this phenomenal group of researchers and innovators that we have. One of the things in our system, and I think this is true of academic medical centers, is all the investments that we've made in research and in teaching. We have people who are doing cutting edge research. And often I think what people need to realize, your clinician who's taking care of you is so well informed of the really highest level, newest therapies, proven therapies, and will be in a position to actually help you get those therapies. That is really leveraging so much of what we do. I think the third thing is a continued and deliberate focus on community health. What are the communities around us? How do we partner with the communities around us to really provide the best care and to really think about care in a much more holistic way, thinking about things like food insecurity, thinking about substance use disorders, thinking about all those things that have such a profound impact on health, and putting that together in a way that really leverages, I think, again, what people in our system and other healthcare systems in the state really care so deeply about. So you're going to be hearing a lot more about that and how we really leverage our people and the technologies that we need to enable that to really make that happen in a different way.
We always buzzwords. That's the key buzzwords, right? One of the buzzwords we've heard for 20 months is collaboration. Yes. And I think when people hear us say, and you said it earlier, you talk to your colleagues every day or daily during the pandemic. I don't think they really believe us. Well, that's just something people say when they talk all the time. Well, I know you talk to your colleagues every morning at 7 a.m. and I have a tremendous amount of respect for the leadership of the systems within our Commonwealth. And I know you do. Can you just talk a little bit about those relationships that were built over those 2 years? And then does that translate into future collaboration?
Yeah, I think that this is what I'll call the false competition syndrome that I often hear about. People will say to me, well, aren't these people competing? Isn't everybody competing? And, I often smile when I hear that, because the competition is competing against the outside world of illness and disease and poverty. And that's what we're competing against. We're competing against COVID. How do we as healthcare systems, as scientists, come together to help people get beyond these challenges? The internal competition that we hear about, yeah, I understand what they're talking about. But to your point, it's the common purpose and what we're trying to achieve here at a time of limited resources, huge demands, and major cultural change. During the pandemic, everyone came together. Healthcare system leaders, every morning on that call, you were there, the governor was there, Secretary Sutters was there, the Attorney General was there. We were all there together. Why were we all there every day? Why did I have constant conversations at night about these things? And there's a single answer. And that answer was, we all came together for a single purpose. And that single purpose was getting people through the pandemic, dealing with the people who are coming into the emergency departments every day with an unknown illness, with unknown treatments, where there was immense fear. That is what brought us together all the time. Everything else didn't matter. Right now, we need to continue to say, we as a state, healthcare is one of the great things about this state. People know us for this. People come to us from around the country and the world to get the kind of care we deliver here. So unifying this purpose around patients, we need to continue. So if we're talking about what are our challenges, there are a lot of them right now. One is how we have to deal with capacity. Every one of our hospitals is struggling with this. Everybody, we are on disaster capacity every day. So if we think about this as a system, if we think about this as a state, how do we all come together and think through what are those needs? How do we help get more care into the community? Not fighting about it, but understanding the needs are immense. How do we look at telehealth? How do we help those communities collectively? That's the collaboration that we're starting to do already. And that's the kind of coming together for a single purpose that has to be done. So, Steve, those calls keep continuing. I talk to a lot of my counterparts around the state, around the city all the time. And I'd say for the first time that I know, we're all thinking together, like, what is it we can do together in terms of working on these challenges? That galvanizing principle, we can't lose that in the terms of competition. I think the other thing we need to come together and think about is we're not for profits, almost all of us, okay? And we need to remember our mission and what that means. The for-profit world is out there, and a lot of the innovation that's taking patients, it's the for-profit world. Is that a terrible thing? It's a different thing. And for those of us who are mission-based, and that's all my colleagues across the state, we need to really remember how important it is to be able to serve communities, to do the kind of research that saves lives. We need to kind of remember this all the time. That's the glue that brings so many of us together every day. And we need to stand together behind that mission.
Yeah, at some point there may be something written about how many lives were saved because of the collaboration among our incredible leaders. And it's not today's conversation, but it really was remarkable. But because we have emerging leaders on the line with us this morning, because I know it's so important to you, I do want to switch gears, just talk personally for a minute. One of the things that you talked about when you were named CEO was your mentorship to women. Do you have any advice for emerging women leaders and for some of those that may already be in a leadership role, but want to become better mentors to others that are coming up?
Yeah, I think that one thing to highlight is that opportunities are there, and sometimes you have to take chances. This is true for everybody, particularly I would say for women, for underrepresented minorities. There are going to be chances, there are going to be risks to be taken. I think it's really important to work hard to identify what those are and what those opportunities are. I mean, there have been a number of times in the past where I've been asked to look at things. And I've been given advice, but you don't want to do that. I'm not sure this is the right time. And I kind of developed a little bit of a flip mentality. The more I heard about that, the more I was intrigued and maybe willing to take on a challenge. So be willing to take on that challenge. The other thing is we talk a lot about mentorship, and I'll just summarize quickly by saying it's not one mentor. It's never one mentor. You have to think about what are those things that you really want someone to be there for you. It might be how to help navigate personal issues. It might be who is going to help you get promoted. It might be how do you best balance research with clinical work. There are a lot, there are 20, 40 of those things, and they apply to people in leadership positions, no matter what your profession is. Thinking about that in a very different way. Don't rely on one person for advice. The other thing I would say is some of the best advice and mentorship that I've received has been out of the system. It's been out of the state. It's been people I've met in professional meetings or in other circumstances. They see things much more objectively. Sometimes it's very difficult to get an objective read from someone who is your immediate boss. Not always, but sometimes. Get that more objective feeling, or get that more objective advice in there, because I think that can be very advisable. But I would also go back to where I started. Sometimes you have to be willing to take some risks, and don't expect someone to come and say, I have the perfect job for you. That could happen, but more likely it's, I've applied to a number of jobs, even though they may not be the perfect job, but now I have a better understanding of what I might want. So sometimes you have to just get out there, take some chances, and really understand what it is you want as a person for your career.
A number of questions have come in via text, via chat, and we're not going to get to all of them. And we tell our folks, you got a half hour. We want to leave them wanting more. And I think we did this morning, but I do want two more questions before we close. And one that came in that I think is really interesting and continues along this humankind discussion. You've spent some time with frontline clinical staff. You've done home visits. You've been in the ED. You were in the field hospital. How do those experiences impact your thinking about how you deliver care to patients?
So I think, Steve, one of the really important things is always to stay close to what it is your mission is all about. And I was seeing patients for so many years, myself at Mass General, having that one-to-one contact, understanding the needs, the voice of the patient is profoundly important. I think it's going around, it's talking to people. There are so few hours in the day to do anything, but if I spend time talking to anyone who's there, who's in a hospital, who's in a clinic, who is in a field hospital, just talking through that experience, talking and hearing from patients. Patients contact me a lot, and I get to hear their stories and understand what that is. So the importance of staying very, very close to who it is and what it is you fundamentally care most about. I think that is really one of the most important things for setting priorities and for crafting a day and for thinking about what it is you're telling the team around you.
We always end with this last question, and it's ironic, right? We don't have enough time to ask the question. And this is probably the problem with most of our leaders, work-life balance. We always run out of time. How do you maintain your work-life balance? What keeps you motivated day in and day out to stay healthy and continue to do the incredible things you do?
So first of all, I get incredibly motivated, and I am incredibly inspired by just talking to people and seeing what's going on around the system. I'm really motivated and excited by change. And when I see change for good purpose, even though it's hard, I get extremely motivated, and I am motivated, and it is a source of a lot of joy and pride and exhilaration at times. I think the second thing is just some downtime. I've got to get back to the English literature major. I like to read. I like to read books. I like to take walks. I like to spend time with my family. And when I do that, I like to just put myself into sort of a different zone. And unless there are 50 texts coming in, which sometimes happens also, as we all know, it's really to craft a little bit of time to just think. And whether that's taking long walks or reading or whatever that is, I think that is really fundamental. That amount of time, whether it's 30 minutes or whatever that time is during the day, is just fundamentally important. And I often talk to people and they say, I don't have 1 minute. And I say, no, I understand that. Believe me, I really understand that. But if you can just put 15 minutes in your calendar, whatever it is, that actually will help enormously in how you manage the rest of your day.
Well, we put 30 minutes on our calendar this morning, and I think it was incredibly helpful for me, and I hope for our audience. Next time we'll do podcasts, the books you're reading, and all the other things we didn't get to talk about today, but unfortunately our time has come to a close. So thank you for your inspirational thoughts and words this morning. Thank you for taking time to be with us. As always, MGB is helping drive our world-class healthcare system forward, due in no small part to your vision, your dedication, and your leadership. It's a pleasure to be able to check in with you this morning. We look forward to following the work of you and your team in the months and years ahead. So thank you very much, Dr. Klibanski. Thank you again to E Inc. and all our sponsors, and to you, our attendees, for being part of today's Executive Insights series. MHA offers great program on a weekly basis. We encourage you to visit our website for more information on what we have in store. You can join us for our next Executive Insight session on November 23rd, when we will be joined by Jody White, President and CEO of Circle Health and Lowell General Hospital, and Executive Vice President of WellForce. We also encourage you to mark your calendar for MHA's upcoming annual Women Leaders in Healthcare Conference next month. This is a special event for us every year, and we already have some incredible content lined up. Stay tuned for more details and make sure you're registered today. Thank you for spending your morning with us, and have a great day.